Excellent. Thank you, Jiggy. Well, look, it's just gone 3 minutes past 10. So I think we'll probably start. People may join as they come along. Good morning, everyone. Welcome to this webinar on hearing more about getting vaccinated. Got a great panel of guests here, so speakers, and so we'll introduce everyone before we start. So I'm Mohan Seeker. I'm a GP in Merton and have been involved with a lot of vaccination program here in Merton. So I'll go around and I'll ask Sarah to introduce herself.
Hi, I'm Sarah Taylor. I'm the Chief Pharmacist for Sutton Borough of South West London CCG.
And could we have Khadija next?
Hi everyone, I'm Khadija and I'm one of the Community Engagement Officers in Public Health for Merton.
And Debbie.
Hello, my name's Debbie Calver. I'm the Infection Prevention and Control Nurse Specialist for South West London CCG.
Excellent. And we've got Jiggy and Aman supporting as well, with any questions which come in.
Thank you, Mohan. Thank you. I'm Jiggy Trivedi Gardner and working in communications and engagement in the vaccination programme.
Excellent. Okay, and Aman's here as well. So let's move on. So getting ready this festive season, hear more about getting vaccinated. Hear about it today. So we'll move on to the next slide. And certainly how we're going to structure today is, so we'll start off with some information about COVID-19 vaccine, then we'll move on to flu vaccine, isolation and testing, and also what supports are available in our community. And then we'll have plenty of time for questions. So please do put your questions in the chat box. Jiggy, just remind us how they put their questions in.
Thanks, Mohan. If you look at if you're on a computer or a laptop, if you look at the top part of your screen, there should be a question mark. And in that question, if you click that question mark, you can add your Q&A into a chat function. If you are on a phone, it will be at the bottom of your screen.
Excellent, excellent. Thank you. All right, well, let's move this on to our first slide. So housekeeping. So we'll be visible, so everyone else can put themselves on mute and also turn the screen off as well. That'd be great, certainly until we get to the question section. Questions can be asked via the chat function, which we just mentioned, and we'll certainly answer those as best we can, either during the webinar or at the end. And if we can't answer any questions now, we'll take them away and bring them back. Just to also confirm that we are recording today's session. Hope everyone's happy with that. Great. Right, let's move this on. So why we're here? Certainly, COVID has gone through lots of varying journeys, meandering, and now we've got the variant. It was Delta, but now it's the Omicron variant, which is rapidly sort of sweeping across the nation. And now we're offering everyone over the age of 18 to book a booster vaccine by the end of this year. And the reason being is that there was a drop in effectiveness against the Omicron variant after just 2 vaccines. There is still some protection, however, this increases a lot if you have your booster vaccine, so your 3rd vaccine, it goes up to 75% of developing COVID symptoms or the impact of COVID if you were to develop COVID symptoms. And so it's really important that we take heed of this and try and get as many people vaccinated as we can. And there's certainly lots of facilities available across South West London to get vaccinated, pharmacies, hubs, and so forth. So we should make sure we do that. And certainly the statistic at the bottom will say that there will be overwhelming numbers by the end of January if we don't do something about it now. So hence the reason for these webinars, and hence why there's a lot of media around trying to get vaccinated. Next question. Sorry, next slide. So lots of key messages. And so the vaccinations have been deemed safe by the MHRA. They are our best protection against the virus. And also it's never too late to get your 1st, 2nd or 3rd, or get your 3rd vaccine as well. I was at the vaccine hub last week and there was still many residents who were coming and getting their 1st vaccine, which was good to see. And so please do encourage yourselves or others or family members to get the vaccine. It's never too late. 2 doses of COVID-19 vaccine are now being offered to children aged 12 to 15 to give them best protection against COVID-19. There is starting to be an increase in children attending hospital or get hospitalised as a result of COVID infection as well. Anyone aged 18 plus who's eligible for a booster vaccine can have one after 3 months following their second dose, so it's really important to remember that. And bookings can be done by a number of ways, online, on the NHS app. There are walk-ins, but that's sort of can be very dependent on various sites. So I'd certainly recommend to book online. And there's certainly lots of information on the South West London website as well, which is again one of those links. These slides will be shared afterwards, so you can have a look at those different links. Thank you. Next slide, please. So why is it important to get vaccinated? So if we have enough people vaccinated, it's harder for the disease to spread to those who can't have vaccines, and so that gives us a lot of immunity as individuals, as a group, as a community. And that getting vaccinated protects yourself, family, friends, and our community from catching the infection. It also reduces the risk of catching it and spreading it. You still can spread COVID once you've been vaccinated, but the chance of that being spread is reduced. And so that's really, really key. We are now seeing in primary care and secondary care a lot of patients who are suffering from lung COVID as a result of the long-term complications of COVID. So being vaccinated will reduce the risk of having long COVID symptoms, which is becoming very debilitating. And so yes, please do also continue the guidance. So wearing a mask, social distance, and act responsible, certainly in crowded areas, keep the window open, or be aware if you're in crowded places as well. So it's key that we get vaccinated to stop the spread and also prevent further mutations from developing as well. So a number of reasons there why we should be getting vaccinated. Thank you. Next slide, please. Where are we at? Is this number 7? Yes.
Okay, so which vaccines are available to you? So there's 3 available in the UK routinely at the moment. There's the Pfizer-BioNTech vaccine, which was obviously the first one. There's the Oxford AstraZeneca COVID-19 vaccine and the Moderna vaccine. If you or your children or your family members are under 18, they will only be offered the Pfizer-BioNTech vaccine. And if you're pregnant or if you're under 40, you'll usually be offered an appointment for either the Pfizer-BioNTech or the Moderna, not the AstraZeneca. Booster vaccines will be with the Moderna or the Pfizer-BioNTech, but whichever vaccine you're offered, all of them have to pass very rigorous tests on safety and effectiveness. So you can be reassured that whichever vaccine you get, it will be safe for you and it will be effective for you. Next slide, please. So who's going to get the vaccine and when will you get it? Well, as Mohan said, the NHS is currently offering the vaccine to anyone over the age of 12. The booster vaccination programme is now available for everyone aged 18 or over who's had their second dose, as long as that was at least 3 months ago. And in England, the vaccine's been offered in lots of different locations. It's available in large mass vaccination sites, such as St Nicholas Centre, Central Shopping Centre, and Centre Court in South West London, as well as others, hospitals, pharmacies, and of course our many local vaccination centres that are being run by our GPs. We are encouraging people to try and book a slot just to guarantee their vaccination and to help try and manage those long queues that tend to form when it's a walk-in clinic. So obviously we still want to ensure that people are safe and are socially distanced. So if we can avoid a queue, then that would be really helpful. So please book your appointment. Information about all of our clinics, including the walk-in clinics, are on our website, and that's updated regularly, and that's at the link that you can see on the slide there. Next slide, please. So Generally, we have much more colds and flu and other viruses circulating in winter, so it's really important to boost your immunity this winter. We now know that we have 2 viruses at least in circulation this year, so it's more important than ever that if you're eligible, that you have both your COVID-19 booster and your flu vaccine this winter. And this will help reduce the number of people who are unwell, because both COVID-19 and flu can develop into serious illness, which means that you might have to end up going into hospital. And in fact, if you get both of them, you're more likely to get more seriously ill. Both vaccines will help protect people from the worst outcomes, as well as reducing the spread and protecting your friends, family, and everybody else in the wider community. Next slide, please. So moving on to the flu vaccine, again, the flu vaccine is very safe and effective, and it's offered to help protect people at risk from getting seriously ill from flu each year. And it's free if you're in one of the eligible patient groups. The best time to have the flu vaccine is in the autumn or early winter before flu starts spreading. So now is your prime opportunity, but you can always get it later. And it's given free to anybody who's eligible. So those groups are listed there. Children aged 2 to 18, anybody aged 50 or over, or if you will be 50 by March next year. If you've got certain health conditions, if you're pregnant, for people in a long stay residential care, or are carers and receive a carer's allowance. If you live with somebody who's more likely to get infections, and of course, if you're a frontline health or social care worker. The flu vaccine is readily available through most pharmacies, as well as your GP surgeries. So again, there should be plenty of opportunity for you to get your flu vaccine if you haven't had it yet. Next slide, please. Khadija, I think you're taking over now, aren't you?
Thank you, Sarah. So now we're just going on to COVID testing. There are two types of tests available to test for COVID. So we've got the PCR test and the lateral flow test. So the PCR test is usually for people who are displaying COVID-19 symptoms, who are close contacts of confirmed cases, and for people who have also been asked to take the PCR tests. The lateral flow test is usually for people with no symptoms, but they want to see if they can be carrying the virus or infections to others. You can order the PCR test online from the government website, or you can call 119. You can also go to an assisted testing site just to get tested at a site. The lateral flow tests, again, you can collect them either through your local pharmacies, you can order them online, or you can also go to an assisted testing site just to get support with testing if you're not feeling comfortable to do it yourself. Next slide, please. So what happens if you test positive? If you're doing a lateral flow test and you've got a positive test, please isolate and book yourself a PCR test. If you've done your PCR test and you've tested positive, you need to isolate for 10 full days. We have heard that there have been updates in the guidance, but we are waiting for more further guidance about isolation rules, and when we do receive that, we'll send that over to you. So when you are isolating, you cannot go out, you cannot go to the work, you cannot go to the office or your school, public transport anyway. You need to remain isolated and follow the guidelines online on the government website. You should let NHS Test and Trace know so that they can inform any close contacts that you have tested positive, and so that they can also isolate and get themselves tested. You should also let your employer know. So if you can work from home, you can do that. And if you can't, they can support you with that. You can also receive help and support via your local council. So local councils have certain things set up so that you can get help with finance as well as food and various other things. Next slide, please. So what happens if you're in close contact with someone that has tested positive? So now you do, as a new rule, you do not need to isolate immediately if you've been in a close contact with someone positive. However, you do need to take the lateral flow test for 7 days. So this is only for people who have been double vaccinated, for people who are 18 years and under, and for anyone that has an exemption. So exemption from being vaccinated. However, even when you are doing your NHS lateral flow test for 7 days, you need to be careful. So if you do test positive, in those 7 days, you need to isolate and book yourself a PCR test. And also you need to let other people know so that they can also do the lateral flow test as well as the PCR test. Thank you. Next slide, please. Thank you.
Hello,
yeah.
my name's Debbie Calver. I'm the Infection Prevention and Control Nurse Specialist, and I've just been asked to come on today just to give some tips on how to stay well over the winter period and stay in your homes with your loved ones and out of hospital. So here are some tips, because we have got some colder weather coming. Winter is coming, and that's the prime time when you've got winter infections like flu, like norovirus, etc., and also slips and trips and what have you. So this is some tips on staying well. Some of them might seem a bit obvious, but it is important to wrap up warm when you go out. So don't get yourself into a situation where you're going to get cold. So prepare for the cold weather. Wear multiple layers. The more layers you wear, the easier it is to shed them and put more on, but it does keep you warmer, and it helps you retain that body heat. Nutrition and having hot drinks and hot food is important. So make sure that you have at least one hot meal a day, that it's nutritious, and that you have hot drinks as well. They will help you keep warm, and they'll help you keep active. Definitely keep active. So if you sit still for too long, then we all know, don't we, that it's not healthy for you. You need to be getting up and trying to move around to get the blood flowing, and that will help you keep warm as well. The more active you are, the healthier you will be. Other tips like using a hot water bottle. So if you are sitting still and you don't want to heat the whole house, because obviously gas and electricity is really expensive now, isn't it? So have other tips like not only wearing lots of layers and a blanket, but having a hot water bottle that can help you, an electric blanket to stay to keep warm in bed. But obviously be careful not to use both, because obviously water and electricity don't mix. And be careful that you turn it off when you get into bed. Make sure that you're receiving all the help to heat your home. There is some government help as well, financial advice and financial support if you need it. Nobody needs to be cold this winter. Keep an eye out for your elderly relatives. We've all got them in our streets, but not only our relatives, but our friends and neighbours as well. Keeping an eye on them to make sure that they're staying well and no one's in trouble. And there is some more information here on this link that you can tap into. Next slide, please. These are some areas that you can go to for help should you become sick or poorly at any time, but particularly over the Christmas period and on bank holidays and weekends. So self-care. Try to stay out of hospital where you can. So self-care for your basic ailments and everything. You treat your cuts and grazes, keep yourself well, upset tummy, making sure that you're drinking plenty of fluids, that sort of thing, and taking paracetamol when you need to, if you need to reduce the temperature. Pharmacies are a great source for advice and support on all sorts of ailments, and they're the community pharmacists. So definitely, if you're not sure, pop into your community pharmacist and they will be able to advise you. They'll be able to administer medicines and healthy living, but they'll also be able to advise you if you need to have something else and go to a hospital or your GP, for example. NHS 111 is a free service that's open 24 hours a day, 365 days a year. And that's if you have urgent help, if you've got urgent help, or you're sick and you're not sure what to do, contact NHS 111 and they will call you back and do an assessment and advise you on what you need to do. Your GP obviously is a great source as well. So call your practice or visit their website, and that will give you up-to-date details of excuse me, what's available, particularly over the Christmas period where they may be shut. There'll be advice on there on where to go if you need out-of-hours service, etc. And then 999 is really for life-threatening emergencies only. We know that our services are very stretched at the moment, and so we need to be keeping these services available for only life-threatening emergencies. Thank you. Next slide, please. So these are some areas that you can go to should you require any support, particularly, as we said, over the bank holidays and the Christmas periods, where people are alone, and you know, problems compound, don't they, when you're alone, and particularly over Christmas periods when everybody's supposed to be enjoying themselves and having fun. So there's the Samaritans, and they're open 24 hours, 7 days a week for anybody that needs to talk. You've got your NHS 111, which I've just talked about, and that's for the non-emergency medical help and advice. Money Helper for anybody in financial crisis or got financial concerns. Shout, this is a text service obviously offering support if you're in crisis and need immediate help. So the mental health crisis, if you're really struggling, that's an emergency number. The Silver Line this provides support and information for friendship for older people who are alone, over 55. That makes me feel really old because I'm over 55, who may feel lonely or isolated. So that's a good support there. That's bespoke for the older population. Standalone is a charity for adults who are estranged and not in contact with their family. So that could be pretty poignant over the Christmas period as well. So this is a good service. And then you've got survivors of bereavement by suicide. That's a bespoke service, and the details are there. Switchboard is a listening service and information for support for lesbian, gay, bisexual, transgender communities. The Trussell Trust. This is a trust for emergency food, so people that are really struggling with, providing food for their families or themselves over the Christmas period, or any period, in fact. The Trussell Trust is a good source. You can go on there, and it will give you a list of all the food banks that are available and where you can go to get emergency help and support. And then Papyrus. Okay, this is one that I'm not actually familiar with. Our advisors are all trained to help you focus on staying safe from suicide. Really, really important, because we know that there's been an explosion of mental health crisis over particularly over the lockdown periods. And as we get into that Christmas, we're into the second Christmas, aren't we, of restrictions and COVID, and it's pretty poignant. So it's for the under 35s that are at risk from suicide, and that's open 9 AM to midnight every day, and there's a text and a email. Thank you. Next slide, please. So this is just some social media messaging that you can use and help, and there's a couple of links there, a couple of slides, and these slides will be available. And I think now we're going to go on to some questions and answers. They're going to be hosted by Jiggy, is that right?
Thank you so much, Debbie, and thank you to all of our clinicians and public health who have shared the slides and information with us today. If you have any questions, there have been some put in the chat, so thank you. If you have any questions, then there is a question mark at the top of your screen, and you can add them into that chat. And if you are on your phone, then there should be a question mark at the bottom of your screen, and then you can again add it into the chat. I will start to run through the questions now, but feel free to ask any more as we go through. So the first question, if the majority of the vaccine you'd had has leaked whilst you were having it, would the GP pharmacist give you another vaccine, or would you need to book another appointment? Can I direct that to Mohan, please? You're on mute.
Yes, yeah, good question. So if it's leaked, will you need a second, another booster, or another vaccine? It depends what was meant by leakage, and how much was entered the person. So, I mean, one would have thought that at the time of getting vaccinated, that the vaccinator would then ensure that the vaccine had gone into the person's or the resident's arm. If it's leaked in preparing it, then obviously they can't use that vaccine. They need to use the appropriate dose. And so I've not heard of that being a query, unfortunately. I'm not sure I'm just to answer that, but I'd imagine if the vaccine went in and it wasn't, for whatever reason, it fell before it went into the person's hand, arm, then yes, it would need to be done again. But if it had actually entered the arm, then I wouldn't have thought it would need repeating. No.
Thanks, Mohan.
I think Sarah would probably be able to.
Yeah, I think in line with what Mohan said, I think it you know, if you've only been given a part dose, then there'll have to be a clinical discussion, because it may well be that you do need another one. But it has to be on it'll be an individual basis, in consultation with your GP.
Thank you, Sarah, and thank you, Mohan, for answering that. I will go on to the next questions now. If that hasn't answered your question and you'd like to add any more into the questions about what had happened, then please feel free to do so. Okay, so the next question. I have COVID and been isolating for 7 days now. I'm still testing positive on an LFD. How long will it continue to show positive on an LFD? Can I direct that question to Debbie, please?
Yes, absolutely. Okay, so once you've tested positive on an LFD, then you should then book and go and have a PCR. Once you've tested for a PCR, the guidance actually now has changed this morning, and I've just been onto the gov.uk website, and it does say that actually, regardless of whether you're double vaccinated, if you've tested positive on a PCR, you've isolated for 7 days and have clinically recovered, so you're no longer sick with a temperature, etc., then you can the isolation can cease at 7 days, as long as you've done the 2 LFDs. Now the LFDs will be done on day 6, and then or not before day 6, and can be done 24 hours later. So you need 2 LFDs 24 hours apart. Now, once you've tested positive on a PCR, you can potentially test positive for some days, weeks afterwards. And so the general rule of thumb is once you've tested positive, you isolate for the period of time, which is now 7 days, and being clinically recovered. And then you would not test again with a PCR for 90 days. The rationale for that is if you test positive with a PCR again, theoretically, you would then have to go back into another 7 days of isolation, and nobody would want that. So you test once for the PCR. To come out of isolation, you take another 2 LFDs, as long as they're negative on day 6 and day 7, presumably. As long as they're negative, you're clinically well, you can come out of isolation. But don't be testing again with a PCR unless you develop new symptoms. If you develop new symptoms, then you must retest, go through the process again. Does that answer the question?
Yes, thank you so much, Debbie. I think that covers it. Is there anything else that anybody else would like to add? Okay, so I'm going to head to the next question. I think this will be directed at Khadija from Public Health. I can't do an LFD test up my nose. Can I do it by swabbing the back of my throat?
Thank you for your question. There are different kits circulating, so some of them are just the back of the nose testing kits. Some are both the throat and the nose. If you can't do the nose if you can't do the swab testing on your own, you can go to an assisted testing site, and they can support you with the testing. But if you feel a bit more uncomfortable and you want to have a chat about how it feels or what it's like, you can also speak to a clinician. So you can speak to a doctor, or you can speak to, again, the assisted testing sites. If you have any worries about it or any concerns about it, again, you can either speak to your GP about that, or the NHS assisted testing sites. Thank you.
Thank you so much, Khadija. So I think this will be directed at Sarah. Next question. Can I pay for a flu vaccine? I'm not eligible for the free version.
Yes, so that is a really good question, because obviously we want as many people to be vaccinated as possible, but not everybody is eligible for a flu vaccine. I would advise you to check the eligibility criteria first, because more people are eligible for an NHS provided flu vaccine this year anyway. But if you're not eligible, yes, you absolutely can have it done privately. You can have it done through a community pharmacy, or many private GP services can also offer it. That is obviously on the proviso that they have the vaccine available. But yes, you can pay for it if need be.
Thank you, Sarah. So this question will be directed to Dr. Mohan. I had my booster last week. Will I now be safe to see my family on Christmas Day?
Yeah, good question. So it normally takes about 2 weeks, isn't it, to get to levels which make you sort of good protection. The fact that you've had 2 vaccines already is good. That will give you some protection. Third booster will push you up to 75% protection from getting COVID. So I think the same rules will apply. You've been vaccinated, so your chance of getting COVID or getting severe infection is lower than if you didn't have a vaccine. So that's a good start. However, I don't know what will happen from now until Christmas Day. So if you do start developing symptoms, then obviously, unfortunately, the same rules will apply, which we've all been abiding to. So hopefully, fingers crossed, things will be where they are. And certainly, if you are going for a family Christmas meal, then we do advise still to observe some of the measures. Maybe have a window open, the distance, and also keep as fewer people in the crowded rooms as we can. So touch wood, things will be good. Thank you.
Thank you, Mohan. Is there anything else anybody would like to add to that? That's a great answer. Oh, Debbie, go ahead.
Yeah, I was just on the back of what Dr. Mohan said. Absolutely, there are other measures that you can take to reduce the risk. There will always be some element of risk, because we know that the transmission of COVID is so great at the moment. But there are things that you can do. So if you've got people that are particularly vulnerable, so my mum, for example, has a type of leukemia, and so that puts her particularly vulnerable. So what we will be doing, although we're all triple vaccinated and boosted, we will be doing an LFD on before we see her tomorrow. We're travelling tonight, so we'll do an LFD. We're going to make sure that that the house is well ventilated, so making sure that where we can, opening the windows, so that will reduce the amount of potential virus that would be circulating, making sure that everybody has, there'll be alcohol gel there. I'm an infection control nurse, there's always alcohol gel, and we're always washing our hands, so making sure that we've got good hand hygiene, good respiratory protection, or etiquette. So if you're sneezing, catch it, bin it, kill it, decontaminate your hands. If anybody became symptomatic, they'd be shimmied out the door, and we'd be testing. So there are things that you can do to have extra layers of protection and precaution to reduce the risk down.
Thank you both, Debbie and Mohan. Fantastic answer for Christmas, especially at this time. And another question, what other things can protect me from COVID aside from the vaccine? Can I direct that to Dr. Mohan and anybody else who'd like to share on that answer? So
what other things can protect you against COVID? Is that what the question is?
Yes, protect from COVID.
Yeah, so I suppose pretty much what Debbie mentioned about making sure that you prevent or reduce the risk of catching COVID would be your first start. So getting vaccinated, wearing a mask, social distancing, having well ventilated spaces, getting LFT tests if you're going to go and see someone vulnerable would be a good start. I think other ways is we talk about pre-rehabilitation, and I'll explain what that means. It means pre, so before. Rehabilitation is to rehabilitate, so get your body as well and fit as it can be. So if you were to get COVID, that your body has a stronger chance to combat it, and that applies for other long-term conditions as well. Sadly, Christmas is a time where people do indulge a lot, so probably not the best time to start doing that. But in answer to your question, I think in terms of general health, I think it's, if you can get yourself as well as you can, get yourself a healthy weight, drink plenty of water, exercise regularly, sleep, and make sure that try and reduce as much stress and connect with others. These are all good measures and good principles which can help with your health and well-being, which will then ultimately prevent worsening conditions. It's when you get isolated that can then make symptoms a lot worse and can make the prognosis worse. So sort of two-strand answer to that. Yeah, thank you.
Really good tips, thank you. Does anybody else want to add anything? Okay, thank you, Dr. Mohan. Next question. I'm probably direct this to Debbie, Sarah, and Khadija, if anybody would like to step in on this one. So, my child missed the flu vaccine at school. How can they get it now? Does anybody, Sarah?
Mohan, I think you might have to correct me. I think if they've done it at school, they tend to go in once and do it, and they don't tend to come back again. I think you'll be able to get it through your GP surgery. So if it's not them, they will certainly be able to signpost you if there's a service that's running and delivering it locally in your area.
Yeah, I think we can do catch-up doses at the practice. If not, they'll be going back to the school to do catch-up ones. But if they don't, then yes, primary care will be the place to get that done.
Thank you. Thanks so much. I think additionally, if you've missed your dose, your school may have contacted you, and they should have provided you with a phone number for the public health, the council public health team, who will give you details of a clinic that will be running flu vaccinations for children. So it's a nasal spray that children between 2 and 18 get. Okay, thank you very much, everyone. And the next question, can I get both the vaccines on the same day? I direct that to Sarah Taylor, please.
Yes, you can get the vaccines on the same day. We weren't doing it previously, but with the booster programme, it has been approved that you can have both vaccines on the same day. And that may be very convenient for some people. Other people may prefer to split it and have the flu vaccine on a different day to the COVID vaccine, and that's fine as well. What you have to remember is that people do report side effects from both the flu vaccine and from the COVID vaccine. So if you have both vaccines, you can expect to get the side effects from both vaccines still. That may affect your decision. On the other hand, if you've travelled some distance to get your vaccine, it would seem a shame to have two journeys if you could get them done at the same time. So there's a bit of flexibility there, but yes, you can get them done on the same day if that's what you would like.
Thank you, Sarah. I think that's a really good answer because everybody's pretty busy at this time of year. So if they can get it on the same day, that might be useful.
And we want everybody to be protected as soon as possible. So, the sooner you get the vaccine, the sooner you'll be protected.
Thank you. Next question. I think I can direct this at Khadija. If I have a positive LFT, how do I travel for a PCR, which is quite a distance away and requires a bus journey?
Thank you. So you can order a PCR test online from the government.gov.uk website. You can do the PCR test at home and you can post it at a priority post box. So you can go online at the website provided in the PCR test and see what your nearest priority post box is. And when you've completed the PCR test, if you post it in that post box, they will be able to collect your PCR test on the day. So if you're not able to travel to assisted testing site, you can always order the PCR test at home and then just post that off.
Thank you so much, Khadija. Really helpful and useful to know people can do the test at home and put it in the post box. I think the next question will be directed at Sarah. At the pharmacist where I had my booster vaccine, a duplicate vaccine card was written. Are duplicate cards meant to be kept by the pharmacies, or was this an error?
Okay, so I'm not entirely sure I understand the question, but I'm going to answer what I think is the question. And if it's not, perhaps somebody can come back and I can give you a proper answer. So when you get your vaccine, you will get a little card, a little blue card that gives the details of the vaccine that you've got on it. It'll give the batch number, it will give the name of the vaccine and the date that you had it. There were supposed to be some cards specifically for the boosters, but they've not been routinely available. So we've been using the original cards as well. So, you know, you may get one or the other, but I would expect that you were given a card that's got all the details of your vaccine that's just been administered. So I hope that answers the question. If it doesn't, perhaps you can add it again and I'll try again.
Thank you, Sarah, and agree. If you want to add more to that question, please do so in the Q&A again.
I was going to add as well, Jiggy, as well. So the cards are useful possibly to have for yourself, but now everything's centralised through Pinnacle, so that actually, if you go to the NHS app, it will be on there, you know, showing you that you've been vaccinated when you had the doses. And actually, lots of places are asking you to show them proof of vaccination. So that will be your proof. As opposed to this card which could get lost. So it's all digital now anyways, but yeah, that may help.
Thank you, Mohan. So it's good to know that the information is stored centrally on another site, so it's not just the card, and the correct information is going to be online for NHS staff. Okay, so next question. The side effects after my first COVID vaccine affected me for a week, which I took early in the year. I felt unwell and couldn't do my tasks for a whole week. What do you recommend? Could I direct this question to Mohan, please?
Yeah, sadly, you can get the side effects. The most common one has been a sore arm. 25% of patients or residents reported that. Like most vaccines, flu vaccines, you can feel a bit sort of groggy afterwards. Some have been, again, that lasting up to 48 hours. And we've been advising supportive measures, so paracetamol, fluids, rest, painkillers, as allows. Lasting up to weeks, that's quite a long time. And certainly if it goes longer than that, you know, you probably want to see your GP to make sure there's not something else happening. But you know, that's a side effect which you got from the vaccine, but that will give you protection. But yeah, so I think my advice would be supportive treatment for that, and treat it sort of as that. Thanks.
Thank you so much. Is there anything anybody else would like to add to that? Okay, thank you. The next question. My family and friends say it's not been tested enough. I'm worried though, as I live with my mother. Can I take my 13-year-old to be vaccinated? Is it really safe for kids? Can I direct that again to Dr. Mohan?
So is it safe? So vaccines for coronavirus have been going on for many decades, and so the coronavirus specific one we're looking at the moment has been certainly been looked at a quicker pace because the whole world's looking at it, and so there's lots of barriers have been reduced because there's a lot of emphasis and focus on getting these vaccines correct. So they've been passed fit and safe by our MHRA, which is our Medicines Health Regulatory Authorization body. Sarah, correct me if I got that wrong, but they effectively regulate all medicines and drugs in this country, and they've deemed it safe. So the answer to the question, yes, it is safe according to our latest regulatory bodies, and it's also safe for children and young young people as well as per the same body as well. So, and lots of children have been having the vaccine, and we haven't had many sort of side effects or reports of any problems after that. Sarah, do you want to add anything to that?
Yeah, I would reiterate what Mohan said, and just to reassure further, it's not just the UK regulatory body that has done these assessments and studies on the safety. It's been done in other countries by their appropriate regulatory bodies as well. And even though it's, believe it or not, it is only a year ago that we started vaccinating, that we've got lots and lots of real life data, because it's been given to millions and millions of people, and has been shown to be very safe. And whilst we've been learning about and studying and testing this technology for vaccine use as well, it's also been used for many years in many other treatments for other conditions as well. The technology's been used in cancer treatments and things like that too. So we've got lots and lots of experience that we can draw upon to be assured about the safety. So yes, you can be assured that it's safe.
Thank you both, Mohan and Sarah. That's a really great answer. I think that brings us nicely on to the next question about, it's kind of about safety too. So I had AZ vaccine for my first 2. Is it okay to get another one for my booster? I have an appointment booked. So Sarah, are you able to answer that one?
Yeah, so the booster would normally be Pfizer or Moderna vaccine. That's what is preferred, and there is plenty of Pfizer and Moderna vaccine in the local system for you to be able to get one of those. There are exceptional or occasional circumstances where AstraZeneca may be used as a booster, but that wouldn't be routine generally, and we would generally encourage you to have either the Pfizer or the Moderna vaccine as your booster.
Thank you, Sarah. I think maybe the question is more about, that's a really good answer as well, but I think the question is more about, is it okay that the person has had AZ for the first 2?
Oh, I see. Okay, yeah, absolutely yes. Absolutely yes. It's fine to have a different vaccine as your booster to what you had for your primary course.
Thank you so much, Sarah. Is there anything else anybody would like to add? Okay, I'll go to the next question. I think that is one of the last questions, unless anybody wants to add anything into the chat. Will walk-in vaccination centres be open over the Christmas period? Maybe the 24th, 25th, 26th, 27th and 28th of December.
Shall I answer that one? Yes, but I can't tell you exactly when. So there will be good coverage from all of the vaccination centres across South West London over the Christmas period. The information should all be on the South West London CCG website, which was one of the links on one of the slides. So that should be all up to date for you, so that you can have your vaccine whichever day you want.
Thank you so much, and I'll let everybody know verbally what that link is. So that will be swlondonccg.nhs.uk, and then you can look on Google or on the website at walk-in clinics near you. So you'll be able to find either walk-in clinics, and if you go to the national booking system, you'll also be able to book in for an appointment, either a pharmacy, a PCN hub or hospital that's providing vaccinations near you. They are running over the Christmas period. Thank you. And I think that draws our questions to a close. If there's anything.
Can you hear me at all?
Oh yes, hello. Hi there. Who's that?
Lindsay.
Hello, Lindsay.
I seem unable to join the function that will allow me to ask a question.
No problem. Please do go ahead and ask your question.
Could I? A member of my family has a long-term chronic illness, and after the second vaccine in August, has suffered side effects ever since, and is only just beginning to recover. And that's rather unpleasant if you've been ill for a long time and then your symptoms have flared up. we're wondering, and therefore doesn't wish to have the booster right now, for obvious reasons, as they're only just coming out of a really unpleasant 4.5 months. Will it be possible to have the booster, say, in 2 months' time? I mean, is it going to be still being available? Will there be? And also bearing in mind that this is somebody who's housebound, and so therefore getting them to something is sometimes quite tricky.
Thank you. Who would like to? I can come in a bit later as on that some of those part of that question. But is there anybody else who'd like to answer that question?
Shall I start the answer? And Mohan and Debbie might want to come in and finish the answer. I'm sorry that she's still feeling unwell or is just recovering now. Yes, the vaccine will be available. It's an ongoing program, so the booster will obviously, and for anybody who hasn't had it, the primary course will be available on an ongoing basis. I would suggest that maybe you or she has a conversation with her GP about how that can actually be arranged for her, particularly if she's housebound.
Yeah, I would probably just add to that as well. And did they have the same reaction after the first dose? Was it mainly after the second dose?
It was particularly striking after the second dose.
Second dose, okay. You know, yeah, sorry to hear that they've gone through that. And yes, I think as Sarah's mentioned, they can be done in the new year. I don't think the program's going to be sort of completed anytime soon. Certainly where we're currently at. And so yeah, I think we should be able to cope with that. Having said that, I think your relative is also probably the high risk group, aren't they? And so the ones we probably want to target more than probably one to a slightly lower risk. So I would encourage it certainly when they're ready, when they're feeling a bit stronger. It goes back to this pre-rehabilitation, so get them sort of as fit and as ready as they can be, so that they can get vaccinated to protect them further going into 2022. Thank you.
Thank you very much.
Thank you, Lindsay, for your question, and sorry to hear your family member was unwell for such a long period of time. And going back to what Sarah was saying, you can get support with vaccinations at home. So just speak to your GP about that for when your family member is ready. Thanks, Lindsay. Does that answer all your questions? Okay.
I actually wondered if anybody is doing any data, for instance, with people with post-viral conditions and the side effects they suffer and the impact on their original illness, especially for people who've been ill for more than a decade.
I'll go to Sarah on that one.
Yeah, there is an awful lot of monitoring of the safety of all of these vaccines, and certainly any healthcare professionals are encouraged to report any side effects, particularly serious side effects, to what's called the yellow card system, which is an alerting system which is run by our regulatory authority, as Mo said earlier, the MHRA. Members of the public and patients can also use the yellow card system to report side effects as well, and we would really encourage that. I will, Jiggy, can I add to the chat here, because what I'll do is I'll go on quickly and find the website and add it to the chat, or we can add it to the slides before we share them.
Yes, of course you can. You can if you go into the questions section, you can add, just although it's not a question, yeah, an answer. Thank you.
I would just add that yes, the yellow card system is certainly something which I'd encourage, residents, if they do have effects, to report, because with those reports we can then learn more about if there's certain conditions which might be affected by it. So yes, certainly do encourage to use it if it's applicable to you.
Thank you very much.
Thank you, Sarah, Mohan. Thank you, Lindsay, for your question. I will go over to, hold on, somebody's got their hand up, so that is Baljinder. Balvinda, sorry. Balvinda, would you like to ask a question?
Hello, thanks very much. It's actually going back to probably one of the first questions that was raised, and this may or may not help whoever asked the question. Somebody said if they had leakage with their vaccine, does that mean that they need to have a second vaccine or not? I also had an issue with one of my vaccines where the poor medical student must have hit something he shouldn't have hit, and there was a lot of blood. So I had that same thought in my head. I'm thinking, oh, most of it's come out, because I think, poor thing, he panicked more than I did, really. And so he was wiping it all off. And when I got home, I thought, oh, perhaps I should have asked the question. So the only thing I said to him at the time was, is everything okay? He said, that's fine. We don't know why it happens. Sometimes people bleed. But I sort of told myself it was fine and I could be completely wrong because I have no medical knowledge whatsoever. But because I had some effects of dead arm and feeling the flu-y symptoms that sometimes we get, I just assumed that I wouldn't have got those unless I'd have had any vaccine inside me. So I didn't really worry about it. I don't know if that's helpful to whoever asked that question, and I don't know if that's the right thing to be saying, and Mohan may well be the one to advise, but it does happen. I think that has happened to a few other people that I've spoken to. So we told ourselves if we got some effects, we were fine. So
thank you for sharing that, Balvinda. And yes, having given lots of vaccines, sometimes that does happen where you do inject, and unfortunately patients do bleed. And that's a number of factors. It could be because the structure or the anatomy of the structure in the arm. It can also be a lot of patients coming very tense. They come very tense like this, like as though they're about to get, really scared. And I'm not sort of having a go. I'm just saying it's just a natural reaction. And when you're tense, it gets very hard. So you end up the vaccine ends up sort of really trying to push it in. And before you know it, you end up going sort of causing a bit of trauma. And actually, what you want to be doing is relaxing your arm as much as possible, so it goes all floppy, and therefore you've got least resistance. So that's just a tip. So yes, I have happened where most commonly when people are a bit tense, that it does bleed. It doesn't mean the vaccine's coming out, it just means that it's caused a bit of irritation and trauma to the local area, which is why 25% of residents do complain of a sore arm after the vaccination. So I suspect it's that. But if it was a leakage, you'd expect some of the fluid to come, bounce back or whatever. But if it's bleeding, I think that's fine.
thanks.
Thanks.
Thank you so much. I think that Balvinda, did you have any other questions? You've still got your hand raised.
Oh, sorry, that's probably I need to take that off. It's a historical hand, sorry.
No problem. I just want to say thank you so much to everybody. Thank you so much for the clinicians and public health for joining us today, especially during this incredibly busy period, to get everybody ready for this festive season. And thank you to the guests and for joining us today and asking the questions that you have. So have a lovely Merry Christmas and a Happy New Year.
Thank you.
Thank you all. Cheers.
Thank you. Bye.
Thank you, everyone. Take care.